family, welcome back to an amazing video. And today we are talking about the second part of prevention of substance abuse. In case you've missed out on the previous videos, we first of all introduced what substance abuse is. Then we talked about the prevention of substance abuse at the family level. Today we are discussing prevention of substance abuse at the school level and at the community level. So if you know you've missed out on the other videos, check here, you will see them is linked and they're all in a playlist. Go there and check on the other playlist so you can see the entire videos. So thank you so much for watching, and come on, let's continue this video now. At the school level, substance abuse, like preventing substance abuse at the school level, there's a whole lot schools need to do, from guidance counselors to teachers to minders. There's a whole lot you need to do. If a school cannot afford a guidance counselor, you that is a teacher, please go to YouTube. YouTube is free, it's free knowledge. Yeah, go on YouTube, go on Google, search for guidance and counseling courses or classes you can take to keep yourself equipped with understanding how to follow our youths and teenagers who are indulging or who have the intention to indulge in substance abuse. It is important that we know how to stop this, because when we get to understand how to stop it, then you get to understand how to follow it whenever you see it happen. So at the school level, I will request that each school should make provision for mentorship programs. Like my school, I'm a school administrator and a certified educator. My school, we have like Friday events whereby they call the children together, they pray, they give talks, right? Pray, give talks, ask questions. We now say, if you have things to say, come individually to the office and let us talk with you about it. It is important that you make this room for mentorship. You make this room for open discussion at school so that you get to find out. When questions are not asked, when questions are not answered, children just imagine things in their head. Now, when the parents do make their own faults at home and not educate their child, it's now left for you, the teacher, to educate. Remember that every teacher in any school is acting in loco parentis. In loco parentis means in the place of a parent. A teacher is like a second parent. That's why at times when they give your child a homework, your child will say, my teacher said I should do it like this. Even when you're telling your child that this is the right thing to do, your child will still reiterate to you and say, oh no, mommy, no. My teacher said, let us draw it this way. My teacher said this is the best approach to it. So at the school level, there is a whole lot. Teachers, principals, minders, cleaners, they get to do in trying to stop the children. I do host school outreaches, and it's not just about saying say no to drugs. You need to state why they must say no to drugs, the different effects of different drugs in their body, right? The different effects of, for example, cannabis, ice, crack, whatsoever, when they take them, and how it gets to affect them academically, physically, emotionally. You need to state it to them. Don't just tell them stay away from drugs. You need to state it to them that when you don't stay away, you could get distracted. You could be drawn away from your dreams and goals. Nobody really wants to be useless. But then if you choose to be useless, just know that you will practically be a burden to the rest. Mental health support is important. Mental health support is not just left alone for the doctors and the nurses. You as a student, you as an individual, you could get training on mental health to place you at a high standing ground, to get you equipped to know how to avoid some certain things or how to follow them when it occurs. Mental health support for students that are coming from homes whereby their parents don't care, or their parents even encourage them to indulge in drug taking. Like I once saw a video of a father carrying a baby. He was smoking and he was giving the baby to smoke. Now that kind of child from that home is liable, and practically when the child grows might end up taking cigarettes just the same way the father does. And you cannot say you would stop it like instantly. It's because the child has learned to smoke right from being a baby. When I say a baby, I mean less than 2 years. If you are able to identify students that are at risk early, this is key. In school level prevention, we are looking at how to identify these children that have tendencies of bringing alcohol to school or cigarettes. If possible, search their bags. Also, monitor Ask the children to ensure that they speak up when they notice one child acting one way or the other. This will help prevent such actions from taking place. I remember in my school, there was a particular girl that brought a bottle of whiskey to the class. And her classmates ran and they reported. They said, "Ma, please, somebody brought a bottle of whiskey." I said, "Why?" And I asked, I said that after all, her parents take whiskey and all these things and nothing happens to them, that they just used to get high and then they sleep off. Now, this is prevention at the school level. We had to take it away from her. We punished her and the rest of the boys she gave the drink to take. Because this is a child that is barely 12, 13 years that is bringing whiskey to the class. If you don't stop it now, it still continues. In some other countries like Korea and China, I've seen some movies whereby they get to show children that are delinquent in action. Listen, there are some things that if you ignore, it keeps breathing. If you don't follow it up immediately, you cannot bend a child when the child has grown far. Parents have their own duty, but as school owners, as teachers, you have a major duty to play to ensure that substance abuse is not seen, is not heard in your school. You have to try your best to ensure that you curtail it to the minimum. Every child must feel important. Every child must feel connected. The school must be a place whereby children get support. Some children might not get support at home, but when they come to school, they are free. They feel loved. Please, as a teacher, ensure that you carry all children along. Don't drop any child down. Don't look down on any child. Don't belittle any child. Don't talk down on any child. A teacher's words has a great impact on a child's life. I can tell you for sure that even after I left primary school, years back, I later on found my nursery primary report book and I opened it and I kept smiling because my form teacher then had very good comments to say about me. It's not just about me getting first. I wasn't really the person that came first in my class in primary school, but then I was always in the middle, like the middle position, and my average was about 70 something, like 76, 70 something. But this teacher had a way of putting beautiful comments in my report sheet. She always said, Chidera, I believe that you could do far better. I believe that you are a shining star. All these statements she made gave me more courage to believe in myself years after I had finished from primary school. So the school should be a place that children find support. Remember that teachers, you are acting in local parentis. That child that is coming to school must not feel like I am in the wrong place or my life is threatened or they are just here to take my parents' money and I'm just here to learn 1+1. No, education is more than just 1+1. Education is learning and building and growing to be a far better version of yourself. So this is prevention on the school level. Now let's go into prevention at the community level. In Nigeria here, we have a doctor, a Aproko doctor. Sometime last year or so, he created this party whereby he says, no substances in the party, no alcohol, nothing, but just come and celebrate, come and party. Now that event Aproko doctor created was a community event to build trust amongst youth and also reduce isolation. Some people, if there are no hard drugs in a party, they wouldn't want to attend. You could still party without hard drugs. You could party and be on a steady high without hard drugs. Youth centers. In Nigeria, I really don't know any youth center, but I want to use Port Harcourt for instance. Let us use Pleasure Park. You see that painting aspect of Pleasure Park, that area whereby you can come sit down and paint, is a good way to get the minds of youth and teenagers away from things around them. So if you're in Port Harcourt, visit Pleasure Park, go to that painting scenario, sit down there, pay them, I think it's 5,000. Sit down and paint. Just sit, paint and be happy. Just keep painting, do little things, little other activities, go to the boat ride, join the boat ride. It is recreational activities that will help clear your mind, and they are all with what? Trained staff, right? They are with trained staff. If we also have more youth centers in Nigeria, I believe it will also help with our current with the current rate by which our youths are going into drugs. We could just tell them, come out, take a walk, go here, go and get recreated, go and play some games, feel happy about yourself, achieve one or two other things that you can. Young people in the community level also need mentorship. I know I spoke about the school, but for the community, I would really love to see a better country whereby we have mental health centers that are open for people to come in, that are free or at least at low cost. Most times, mental health costs are not, like mental health support are not so free, and people get to avoid them because they feel that they are going to spend a whole lot. Mentorship programs pairing young people with positive adults. Access to low cost or free mental health services is also very important. If they're able to get low cost and free mental health services, this will also help. So I would love communities to consider building mental health homes or mental health support facilities whereby youths can get access to free or at least low cost. This one is for the NGOs and public health educators like myself. It's important to give community support, community education to parents, community education to caregivers. If you can do this maybe as a school outreach or as a community outreach, give support, give create checks, do blood pressure check, blood sugar check, and then still give guidance to parents and caregivers and say, please attend this mental health support meeting. Let us discuss the things that are affecting us in our community. There are a lot that we can do, and there are a lot that we can achieve by just making sure that the community is in a better position. So it is important that you do your own part and I do my own part. Let us work together to ensure to prevent substance abuse in the school and also at the community. These days, children are putting themselves under unwanted pressure. Youths are placing themselves under unwanted pressure into taking substances that they cannot even handle. You are not supposed to take such substances, and then why going into it, why taking such substances? So thank you so much for watching this video till this moment. My name is Chidera. I am a certified educator, public health educator, and I am your number one cheerleader in living a good life by standing firm with preventive care. Till another time, thank you. And don't forget to check the next video, which is on substance specific education. In that video, I talked about the different substances and how it gets to affect the body of the youth and teenager. Thank you for watching.